Shouldn't hospitals publish pricing? Can't we, based on all the research and data that I just presented to you, make the case for price transparency and publishing? It looks like hospitals won't. Patients want to compare. Patients want to shop. But hospitals won't enable their ability to shop around. This seems to be the behavior worldwide and even in markets like the United States. As recently as 2021, there was this federal act that was mandated on pricing transparency. It was called the Hospital Price Transparency Final Rule. And this mandate required hospitals to post payer-specific negotiated prices, discounted cash prices, and standard charges for all items and services in a machine-readable format. Quite extraordinary, actually. The rule also mandated a customer-friendly list of such price-related information for 300 shoppable services, undifferentiated, generally plain, straightforward medical services, of which 70 were specified in the rule, and the Federal Act allowed the hospitals to determine the remaining 230, but they had to post pricing information for 300. The government mandate also included a penalty ranging from $300 to up to $5,500 per day for default and non-compliance. The goal for this rule was to rein in cost and to promote transparency. And the rule basically uses price transparency to reduce information asymmetry and allow some kind of benchmarking between hospitals and allowing patients and insurance companies to make informed choices about which healthcare system they would like to patronize. And this benefit from transparency would percolate and reduce healthcare costs across the continuum of healthcare delivery. But what happened? Pretty much nothing. Despite all these measures, including penalty, the compliance is very, very low. Several years down the line, the rulers had no impact, as is evidenced by the wide and the large pricing variations that are still endemic. This in a mature US market, and imagine the situation in other economies, emerging economies. Because in the US, the insurance companies are very strong and have a fairly robust bargaining power. This is not necessarily true in other emerging economies. So you can only imagine the situation. I'm sure that the governments of the day around the world are looking at this closely because hospital pricing has been galloping at 2 or more than 2.5x times inflation year on year for decades now. And hospitals cannot continue with this behavior with respect to pricing. And I think they have to make this change and change for their own good. Pricing transparency will force hospitals that charge a premium for undifferentiated services to redefine their value proposition, or they should prepare for compromise on margins. At the same time, high-performing hospitals that have good outcomes, highly coordinated care, and if their rates do not reflect the value, then they will be in a position to justify that premium and charge higher, thereby improving their margins, pay for performance. Price transparency rules and pricing innovations can truly change the healthcare landscape in very profound ways As policies, economics, and medical sciences converge and mature. As we get to the end on this discussion on pricing transparency and pricing conundrum, I'd like to circle back, and there might be some benefit in doctors asking a few questions of themselves, simple questions that might reveal how opaque and unclear hospital pricing is, even for doctors. Imagine the plight of our patients and our general population. As a doctor, do you discuss the cost of care with your patients? To what level of detail? Do you, as a doctor, have access to accurate estimate of your care for your patient? Do you think price transparency is important across stakeholders? And do you think that the hospital pricing continues to be mysterious, chaotic, veiled in secrecy?